Have you ever wondered what are the unusual signs that cancer is growing in your body? Today, we're diving into this important topic. We'll discuss 15 subtle and surprising signs cancer is silently developing, signs that are often overlooked or mistaken for something minor. Some of these may seem unrelated, but they could be your body's way of warning you. So stay with me until the end. Your health could depend on it. This isn't to scare you, but to make you more aware of what to look out for. Remember, if you're worried about anything, always talk to your doctor. Now let's get started. Persistent and extreme fatigue. Let's start with something we all experience, fatigue. But unlike the usual fatigue, this one is different. It's persistent and extreme, meaning it sticks around for weeks or even months, and it's not the kind of tiredness that goes away after a good night's sleep or a relaxing weekend. Think of it as a profound lack of energy that really impacts your daily life. Why does this happen? Well, cancer cells grow rapidly and can essentially steal the body's energy resources. Some cancers also release substances that mess with our normal energy production. Conditions like anemia, which some cancers can cause, can also lead to this overwhelming exhaustion. The key takeaway here is a sudden, lasting change in your energy levels that doesn't improve with rest. That's a red flag to discuss with your doctor. Before we continue, I want to emphasize again that experiencing one or even several of these symptoms that I'm going to discuss doesn't automatically mean you have cancer. Many other non-cancerous conditions can cause similar symptoms. The key is the persistence of these symptoms over several weeks and the lack of a clear, non-serious explanation. Next, unusual fevers or night sweats. We all get fevers when we're sick, and sometimes we might sweat a bit at night. But the kind of fevers and night sweats that could be a sign of something more serious are unexplained, meaning they don't seem to be linked to an obvious infection, and they might have specific characteristics. Medical experts like the Mayo Clinic and Cancer Research UK point out that unexplained fevers, especially those that keep coming back, could be a sign. And night sweats associated with cancer are often described as very heavy and drenching, to the point where you might need to change your clothes and bedding. While occasional mild night sweats can happen due to hormones or medications, these intense, unexplained episodes warrant a checkup. Next, persistent pain in unexpected areas. Pain is our body's way of saying something's not right. While most aches and pains are harmless, persistent and unexplained pain that doesn't go away or even gets worse over time should be evaluated by a doctor. Think of it as new pain without a clear injury or reason. Cancer can cause pain in a few ways. As a tumor grows, it can press on nerves, bones, or organs. Cancer cells can also release chemicals that trigger pain receptors. For example, back pain could sometimes be related to a tumor pressing on nerves in the spinal cord. The key here is persistence and the lack of an obvious explanation. Don't ignore pain that just won't quit. Next, unusual skin changes. Now, let's talk about our skin. We all know to watch out for changes in moles, but there are other, less obvious skin changes that can sometimes signal internal cancers. First, jaundice, which is a yellowing of the skin and the whites of the eyes. This is often linked to liver problems, but it can also be a sign of cancers affecting the liver or pancreas. Second, darkening of the skin, also known as hyperpigmentation. A gradual darkening could sometimes be associated with liver cancer. Third, reddish skin or erythema. This could potentially be linked to kidney cancer or lymphoma. It's different from a typical rash and might look like a widespread flushing. Fourth, persistent itching or pruritus. Unexplained and severe itching can sometimes indicate liver cancer or lymphoma. Fifth, increased hair growth in women, particularly on the face or chest, could be a sign of ovarian cancer. Remember, many things can cause skin changes, but if you notice any of these, especially alongside other unusual symptoms, it's worth getting them checked out. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Don't forget to subscribe for more health-related content. And as always, take care of yourselves and prioritize your health. Next, changes in bodily functions. Our bodies have regular routines, and significant disruptions to these routines can sometimes be a clue. Changes in bowel or bladder habits are a big one. This includes things like persistent diarrhea or constipation, blood in your stool or urine, or changes in how often or urgently you need to go. The NHS specifically mentions tummy discomfort, blood in your poo, diarrhea, or constipation lasting more than 3 weeks without a clear reason, and feeling like you haven't fully emptied your bowels. These can be signs of cancers affecting the colon, bladder, or prostate, among others. Unusual bleeding or bruising without injury is another concerning sign. This could be blood in your urine or stool, unexplained vaginal bleeding between periods or after menopause, bleeding from your rectum, or coughing up blood. Also, sudden, excessive bruising in unusual places without a clear cause could point to certain blood cancers. And finally, a persistent cough or hoarseness that lasts for more than a few weeks could be a symptom of cancers affecting the lungs, throat, or thyroid. Even a change in your voice to become strained, raspy, or softer could be a sign. While colds and infections are common causes, a cough or voice change that doesn't improve should be checked out. Next, digestive, neck, and oral cavity clues. Sometimes the clues are in our digestive system, neck, and mouth. Persistent indigestion or discomfort after eating, especially if it doesn't get better with over-the-counter remedies, could be a sign of stomach or esophageal cancer. Frequent or severe heartburn or acid reflux that doesn't improve with standard remedies should also be checked. While increased burping or hiccups are common in many benign gastrointestinal conditions like GERD, gastritis, ulcers, and dietary issues, their new onset or a noticeable increase alongside other alarming symptoms could be a reason for concern. The key factor is whether these symptoms persist despite treatment or occur alongside other concerning signs. Difficulty swallowing or dysphagia, feeling like food is getting stuck in your throat, can be a symptom of cancers affecting the throat, esophagus, or stomach. And unusual changes in the mouth, like sores that don't heal, white or red patches, or persistent pain, can be signs of oral cancer. Pay attention to any sores that haven't healed within a few weeks. Other less common indicators. There are a few other less common signs that are still worth mentioning. Persistent, unexplained muscle or joint pain that isn't due to arthritis or injury could, in some cases, be a sign of bone cancer or cancers that have spread to the bones. In rare cases, the body's immune system can react to cancer and cause unusual immune system reactions, also known as paraneoplastic syndromes. These can manifest in very unusual ways, like difficulty walking or even seizures. If you are experiencing any of these unusual or persistent changes in your health, please consult your doctor for a thorough evaluation. Early diagnosis can make a huge difference in treatment outcomes for many types of cancer. While it's important to be aware of these potential warning signs, try not to jump to conclusions or cause yourself unnecessary anxiety. The goal here is to encourage you to be proactive about your health and seek professional advice when something feels off.